Good evening, Mariam.
Good evening.
Okay. Good evening, everyone. I am Jarapla Srinivas Nayak from IAP Digital Media team. I will be the host for today's webinar, which is on the topic importance of pelvic floor muscles in women's health in association with Inner Wheel Club of Chennai Unique. So I will be the host today, and which is this webinar is organized by IAP Women's Cell Chennai District, Tamil Nadu State. The Indian Association of Physiotherapy is the oldest and largest association which is representing the physiotherapist in India since 1955. IAP Digital Media team consists of a group of physiotherapy professionals who handle the Zoom platform, webinar live streaming, IAP profiles, across the various social media platforms like Facebook, Instagram, Twitter, LinkedIn, and YouTube. So I request all the attendees to please follow the IAP social media platforms on various to receive various updates on webinars, workshops, CME programs, conferences, health camps, blood donation drives, and to more about recent advances about the physiotherapy. And also I request all the attendees and panelists to subscribe to our IAP YouTube channel to receive live notifications about the webinars. And we have a large collection of webinars which are in our YouTube channel, which are segregated and which you can access accessible. So without much delay, I request Divya Karthik ma'am from Chennai district to take over the session. Over to Divya ma'am.
Thank you so much, sir. Good evening, one and all here. I'm Dr. Divya Karthik, physiotherapist, Chennai District Coordinator. I wish all a very happy Women's Day for all the lady superstars here. So, a woman is always celebrated by everyone, right? We all know that. She's the backbone of the society. She is so dedicated and sincere to her profession, and wherever she goes, she's very loyal. But also, she thinks about her family all the time. What to prepare for dinner, how to make my child stronger, how to make my home happy. So many thoughts, right? The multitasking term is really coined for the women. But is she, apart from these things, is she really healthy? Does she care about her own health? So this webinar is about to make all women understand about taking care of their own health. So to make the society stronger, we have two eminent resource persons here to make us understand about a group of muscles which plays a very major role in the women's health. So before going to the session, I take the pleasure in introducing Mrs. Meena Satish, President of Inner Wheel Club of Chennai Unique. A few words about her. She's an entrepreneur, social media influencer, and founder of Subiksha Groups, dealing with nuts and dry fruits, logo designing, poster designing, LED banners and backdrops, social media management for her clients, like video editing, and she has also received Suya Shakti Digital Homepreneur Award, Innovopreneur Award from Iris Foundation, Lakshya Magudam Award from Crescentia Educational and Charitable Trust. Now I request Mrs. Meena to share a few words for us.
Thank you, Vidya, for the thank you, Dr. Divya, for the brief introduction. I extend my warm greetings to all the dignitaries present here and the attendees of this meeting. I just want a brief about the Innovale. Innovale is an international women's organization to create friendship, service, and understanding. The organization was officially founded on 10th January 1924 by Margaret Golding, a nurse, a businesswoman, and the wife of Manchester based Rotarian. So it was basically the Rotarian spouses were there in the inner wheel, and later it has been extended to all the women across the globe. We are celebrating our centennial year this year. The International Innovate objectives are promoting true friendship, encouraging the ideals of personal service, and foster international understanding. In 2008, Innovate had over 1 lakh members in 102 countries and was one of the largest women's organization with a consultative status at United Nations. We are one of the largest women's service voluntary organization in the world and are active in more than 104 countries. We have more than 1 lakh members and 3,895 clubs worldwide. We belong to Innovale District 323, chaired by Aarti Narayanan. Our district has 68 clubs and 2,000 plus members. We have been into a social service. We are women volunteers in service, doing our part for a better and stronger world.
Thank you so much, Meena. Now I request Dr. Parvati to introduce our speaker, Dr. Bhargavi Rangarajan. Parvati ma'am, on to you.
Good evening, everyone. Um, um, Happy. First of all, I would like to wish all the women folks in this group a happy Women's Day to you all. I feel very much privileged to introduce our first speaker of the day, Dr. Bhargavi Rangarajan. Bhargavi ma'am has completed her MBBS from Government Kilpauk Medical College and Hospital, and she's also finished her MS in Obstetrics and Gynecology from Government Medical College Hospital, Alappuzha, Kerala. And she's also finished her post MS DNB in Obstetrics and Gynecology, and she's a consultant obstetrics and gynecology in Dr. Kamakshi Memorial Hospital right now. Coming to the topic of today, pelvic floor health, which is such an important but less talked and less explored topic by all of us. I request all of you who have joined here to listen with all your mind and heart to this session. Let's listen to our young, dynamic Bhargavi Rangarajan as she takes us all through this journey of understanding our pelvic floor in a better and beneficial way. Over to you, Doctor.
Hello. Yeah. Am I audible?
Yes, ma'am. Very good
Yeah.
evening.
Yeah. Good evening, everybody. So it gives me immense pleasure and honor to address this gathering as a part of International Women's Day celebration that's conducted by the Indian Association of Physiotherapists, Women's Cell Chennai. So at the outset, I'd like to extend my heartfelt Women's Day wishes to everybody here. I'd also like to thank Dr. Parvati ma'am for giving me this opportunity to shed some light on the not so popular and often ignored aspects of women's health, which is nothing but the pelvic floor muscle and the pelvic floor health. So, I'm Dr. Bhargavi. Excuse me. I'm sorry, excuse me.
Dr. Mariam, can you be on mute?
Excuse me.
Thank you, Mariam. Yes, doctor, you can continue.
Excuse me.
Doctor, can you hear me?
1 minute. There is some trouble.
We can see the slides, ma'am.
There is some noise I'm getting here. 1 minute. I'm sorry. I'm sorry for the trouble. Just 1 minute. I'm sorry. Excuse me.
Yes, ma'am.
Yeah. Sorry for the trouble. I heard some noise in between, so that's why I couldn't. Am I audible now?
Yes, ma'am, you're very much clear. You can
Yeah.
share your slides.
Sorry for the little delay here. Okay, I'm Dr. Bhargavi, consultant obstetrician gynecologist at Dr. Kamakshi Memorial Hospital, and I'm here to take you through the pelvic floor health in women, empowering your core. So before we get into the topic proper, just let me brief you through about the pelvic floor health. So what is this pelvic floor? It's basically a group of complex muscles along with its ligament and supportive tissues and the nerves that help support and control the bowel and bladder along with the uterus and the vagina. So basically, it's a complex muscle, which we call it as the levator ani, which in turn has three other muscles, as you can see in the picture, wherein we have three natural orifices for the urinary outlet, which is the urethra, and you have the vaginal opening, and we have the anal opening. So these
Bhargavi
muscles have
ma'am,
to, yes,
can you go for a slide show, ma'am? We can see all the slides actually. Go for a slide show, ma'am.
think
Bottom down, the fourth icon.
much better.
Yeah, now it's good, ma'am. Yeah.
Yeah. Okay. So we have this levator ani muscle, which is in turn divided into three other muscles, where we have this puborectalis, iliococcygeus, and pubococcygeus muscle. And this levator ani in turn has three openings for the natural orifices for the urinary outlet, which is the urethra, the vagina, and the anal opening. So these muscles actually in turn work in a coordinated fashion. They contract and relax in a particular fashion so as to enable good bowel and bladder control. So this pelvic floor can be damaged by a lot of factors. The most common being this increasing age as we age, repetitive childbirth. It can be both cesarean as well as vaginal birth, heavy lifting or straining, and factors like obesity, chronic diseases or surgeries, sexual abuse, degenerative neuromuscular disorders, and spinal nerve injuries, etc. So why do we have to focus on this pelvic floor problems? So why are they important? So that's basically because the statistics speaks. Though it's very common, it's most often underreported because women often find it very embarrassing symptoms. They often get like embarrassing symptoms, so they don't feel free to openly discuss about these conditions to their healthcare personnel. So they often neglect these symptoms. So they end up coming late to the doctor. It is usually seen in almost like one third of all women and one half of elderly women. That's as common as that. So one in four suffer from pelvic floor disorder, and among the various pelvic floor disorders, urinary incontinence is around 17%. So what happens is in due course of time, it reverses the women's quality of life. And these are commonly very treatable conditions once they present to the doctors at an early stage. So why are they important? Because they enhance or they're very important for the bladder and bowel control, play an important role in sexual life. It's just not the adults or the elderly geriatric population whom we come across with pelvic floor disorders. Even young women when active sexual and reproductive life tend to report almost 40% of them report some form of sexual disturbances or discomfort in the form of painful sex dyspareunia or vaginismus, which is tight, the levator spasm, which causes painful coitus. And those with repetitive childbirths tend to have lax vagina, and therefore they tend to report arousal and orgasmic disorders. And apart from this, good pelvic floor muscle, the pelvic floor function, it facilitates vaginal delivery, also reduces menstrual cramps. So it's just not the problem only with the elderly. It actually caters the health of the pelvic floor caters across women of across all the ages. So it's important that we understand and prioritize and give importance to pelvic floor health as well. So dispelling some misconceptions about pelvic health. Uh, Commonly, we tend to see women coming late, presenting with complaints of urinary leak or some prolapse kind of thing. They usually come late thinking it to be a part of normal aging. That's not so. They are common with aging as a consequence of childbirth and as a consequence of menopause. They are commonly seen among these risk factor groups, but they are not normal. So once you find that you have these symptoms, do openly discuss with your doctors, know your risk factors, and get it tested. And if at all, certain conditions can be treated without any surgeries with lifestyle modification and appropriate physical therapy training. And finally, only comes the other treatment options like minimally invasive and other surgical procedures. Pelvic floor disorders, in general, they occur as a result of incoordinate action of the pelvic floor muscles. This can be in the form of hypotonicity, wherein the increased tone or the reduced tone of the pelvic floor structures and the support structures, the loss of support, and it can also be because of mixed concerns, which are more general and non-specific conditions. The commonly encountered condition in our practice are dyspareunia because of tight vagina, uh, most commonly seen with vaginismus, pelvic organ prolapse. Then we have enterocele and rectocele, which we commonly see in day-to-day practice. And it can also be in the form of urology conditions like cystocele, urinary incontinence. And when it comes to the bowel movements, the colorectal conditions, commonly they present with constipation and fecal incontinence. And other non-specific conditions are like chronic pelvic pain, levator spasm, and perineal descent. So the common pelvic floor, I will just talk to you about two important conditions which are actually causing a lot of discomfort to the patient, to the ladies, especially when it comes to the day-to-day activities. So the one thing is the pelvic organ prolapse. The other one is going to be the urinary incontinence. So urinary incontinence, as I said, is the leading cause of pelvic floor disorders among women. It accounts for around 17%. The women's lifetime risk for requiring surgery for incontinence or prolapse is around 11%. So though there are many others, but some of them, they don't require a surgery. Probably they are very early in their, probably they are in the early stage of the disease, or some they don't choose surgery. So coming on to the pelvic organ prolapse proper, the supportive tissues uh, in the pelvis, they become weak, and hence the pelvic organs, they drop. So the cushion or the hammock or the sling action of the pelvic floor muscle is lost, and hence it causes a bulge or protrusion in the vagina, or sometimes it can even come out of the vagina and lie outside. So the prolapse, again, as I already told, the image is very clear. The first picture shows the normal anatomy with regard to the bladder, the uterus, and the rectum. The second picture shows the relationship wherein the anterior wall of the vagina becomes weak or lax, and hence the bladder bulges into the anterior vaginal wall, and it causes a bulge into the vagina. So what happens is these patients, they typically present with incomplete emptying of the bladder, and they'll have the increased urge to pass urine very frequently. However, they will not be satisfied, or still they feel that something is left behind. So that's the most common presentation with the cystocele. In case of uterine prolapse, as you can see in the picture, the uterus has come down, has descended down from its normal anatomical position. This can come down, and sometimes it can even lie outside the introitus. The last one is going to be the rectal prolapse, wherein there is laxity of the posterior vaginal wall. So hence either the intestines or the rectum can bulge inside into the vagina. So now the causes for the pelvic organ prolapse. The most common is going to be the normal physiological aging. It's most commonly seen with postmenopausal ladies because of estrogen deficiency. And apart from these, having multiple vaginal deliveries, it's not difficulty in experiencing. It's basically those who have had a difficult delivery. Say, for example, an instrumental delivery or delivery of a big baby by vaginal birth. And the conditions which is going to increase the intra-abdominal pressure, like obesity, chronic cough, chronic constipation, or straining. And there are also familial causes of pelvic organ prolapse due to connective tissue disorders which can run in families. So how do usually women present are, they'll have some feeling of heaviness or pressure in the pelvis, seeing or feeling a bulge to the vaginal opening, some low back ache. Probably some women can present with sexual dysfunction, especially with uterine descent, voiding difficulties. Some women tend to splint to assist voiding, which means they will digitally reduce the swelling inside, put their fingers inside to reduce the bulge in order to assist urinating, and difficulty with bowel movements. So now talking about the incontinence per se, we have many types of urinary incontinence. Based on the type and based on the cause, we classify them broadly as stress incontinence, urge incontinence, overflow, and neurogenic incontinence. So, stress incontinence is a condition wherein those activities wherein which is going to increase the intra-abdominal pressure, say like coughing or sneezing or doing some physical activity, bending down, will cause a little amount of urinary leak. So this is called as stress incontinence. So the next is going to be the urge incontinence. So urge incontinence is a condition that is because of detrus or hyperactivity or overactive bladder, we call it. That is because of involuntary contraction of the detrus or bladder muscles. That's urge incontinence. The basic difference is in stress incontinence, patient will not have the urge to pass urine. It's just that at the occasion of increased intra-abdominal pressure, there is some minimal quantity of urine leak that is noticed by them. In urge incontinence, these patients, they will have the tendency or they will have the urge to pass urine, but before they could make it to the restroom, they'll start leaking. That's how it is. In overflow incontinence, it's usually there's a full bladder, but there is some problem in the distal end. There is some blockage, the urine coming out. So what happens, the bladder is completely full. At that point in time, there will be a small amount of leak. That's because of some obstruction at the distal level, at the urethral level. Then we also have the other type, which is called as the neurogenic incontinence, which is commonly seen in those with some form of physical or mental disability, wherein they are not able to reach the restroom. So hence they wet. It's mostly a problem with the central nervous system per se. So again, the causes for incontinence in general are almost the same as that of pelvic organ prolapse. Basically, the laxity and the weakening of the pelvic floor muscles. Most commonly, it's the postmenopausal age group, increasing age, multiple childbirths, and nervous system disorders, obesity, and it can also run in families. So as I already told you, it's just the basic outline wherein we can see the picture showing the women were doing some activity and it's causing a urine leak. The second picture down showing coughing, it's typical of stress urinary incontinence. And the last one, the middle one at the bottom, it's more of a physical or mental disability. So wherein she's not able to get up and go to the restroom, hence there is a urinary leakage. It's more of neurogenic incontinence. And the one to the right side, she is having the urge, but before she could reach the restroom, there is urinary leak, which is more so of urge incontinence. And there are other temporary conditions like UTI, urinary tract infection, and certain medications which can cause incontinence, like diuretics, which usually gets better in time. And this once the UTI settles, the symptom also ceases off. So now, when we have a woman coming with any of these complaints, we always get a detailed, we elicit a detailed history and do the required examination, physical examination. The required investigations based on investigations like a urine analysis, probably if at all it's needed, probably an ultrasound to check for the post-void residual urine. And the most important thing being the bladder diary. So we have something called the 24-hour bladder diary, which is a tool used to record the liquids that the person consumes and the pattern of that is, and the pattern of your the avoiding pattern in the last 24 hours. So if you see here, the chart shows the time the patient should write the time at which she had she had passed urine. How strong was the urge to void? That will be graded by the patient as to 0, 1, or 2 based on the severity of the urge. And did you, presence of any accidental leak while coughing, sneezing, or straining? That has to be marked as yes or no. And what were you doing? And what was the patient doing at that point in time? Whether she was lying down or whether she was working or whatever, that has to be. This will be documented by the patient over the last 24 hours. And this also has the fluid intake, what she has taken over the last 24 hours, how much quantity and what was the fluid. Was water or coffee or alcohol, whatever it is, it has to be charted along with the time. So with this will guide the treating physician to understand where the problem is, and it will streamline the further plan of action as to uh, further. It will help us decide further, investigations as well as the management plan. So treatment decisions, pelvic floor disorders in general require a multidisciplinary approach. Usually it involves a urologist, gynecologist, and a trained physiotherapist who will work together in order to bring in and to draft a good plan of action for the patient to improve the quality of life. So it all depends on the symptoms with which they present and how the symptoms affect the patient's quality of life. So the treatment can vary from actually no treatment at all, some form of lifestyle modifications and behavioral treatment, medications, yes, and some form of non-invasive or minimally invasive procedures, and ultimately surgery, that's going to be a significant symptom which is going to affect their quality of life. So the first is always the conservative management, which we talk about. For example, the first thing is called as watchful waiting, wherein we don't do much about the condition. Say, for example, a patient comes to us for a pap smear, routine pap smear. A 40-year-old lady is coming to us for a routine pap smear. On examination, we find there is a little descent of the cervical descent, or we say just a first degree descent, which usually doesn't cause much of trouble to the patient. In fact, patient herself will not know, will not produce any will not have much of trouble. It's just that we have examined her and we have found out there is a little descent of the cervix. So what we will do, we will just advise her, say this is the condition, and probably we can address the risk factors. So modify her lifestyle, adopt healthy lifestyle, optimize her weight if she's going to be on the overweight side. The diet and the fluid managements can be done. We need to train her on good Kegel's exercise, pelvic floor muscle strengthening exercises, which will be dealt in detail. So that has to be taught to them so that this first degree doesn't deteriorate over time. So it doesn't worsen over time. And there's something called bladder retraining and timed voiding, wherein women, they are taught to void timed space regular intervals so that they don't uh, they'll be able to cope up with the incontinence per se. And Kegel's exercise will be dealt in detail shortly. And there are also medications and nerve stimulations, sacral nerve stimulations for urgent incontinence and overactive bladder. And apart from all these things, we also have vaginal pessaries for stress urinary incontinence and pelvic organ prolapse. So pessaries are basically a silicone, rounded silicone structure which we actually insert into the vagina in order to support the descended uterus to prevent it from further sagging down. And I'll just show the picture. Yeah. Here, if you see this round shape, the ring pessary with support is the one which we commonly use, wherein the uterus which is descended, this helps in elevating the uterus, keeps it in the normal anatomical position. So at the event of any kind of stress, if cough or straining, this doesn't come down. So usually it's an OP procedure, which can be safely done. Actually, even when the patient herself can learn to get it inserted herself. If not, it's a normal OP procedure which we can insert and let the patient go immediately. It doesn't require any anesthesia, and it's ease of insertion and removal basically. And this is suitable for those who are not fit for surgery and who are probably not willing for surgery also. Those with multiple comorbidities, say a very old age, fragile patient with a lot of high risk factors to undergo surgery. This is a very good option, giving good relief, symptom relief, both for stress incontinence as well as pelvic organ prolapse. The other modality, which is now recently gaining popularity among the, especially in the metropolitan cities, are the cosmetic gynecological procedures like fractional carbon dioxide laser, and we also have radiofrequency therapy, RF therapy, and high intensity focused ultrasound machines. These are basically used in conditions wherein there is lax vagina. So this helps in vaginal tightening. This is very useful for those women with pelvic floor disorders having sexual dysfunction, like some arousal orgasmic disorder. This helps in tightening the vagina and giving good symptom improvement. And it is also useful in those women having mild to moderate stress incontinence and cystocele as well. These are now gaining popularity actually. And the lastly, we have, yes, the surgical management for those with significant symptoms hampering their day-to-day activities. So based on the compartment where the problem is, if it's the bladder side, it's going to be cystocele, we do the anterior and the anterior colporaphy. If it's the rectocele, we'll go for the posterior colporaphy, which are again, it's all site-specific corrections which we do for pelvic organ prolapse. And again, for incontinence, we have other options. Like we have botulinum toxin A for overactive bladder, wherein we actually do intravesical injection. We just inject this toxin A, botulinum toxin A, into the bladder for overactive bladder, so that this relaxes the detrusor muscle and cause symptom improvement in case of urge incontinence. Then Birch, colpo suspension, mid-urethral sling are other recent modalities which we do for stress incontinence. So now, just a short description on how to perform Kegel's exercises. This Kegel's exercise is very, very important. So it's not just women focusing more on the cardio exercises and strength training and resistance training. Pelvic floor exercises are very, very important across women across all age groups. So the how do we do this is basically you will have to identify your pelvic floor muscles. So you have the three natural orifices, the urethra, the vagina, and the anal opening. So the muscles surrounding all the three openings are to be focused precisely, and those muscles are to be squeezed and relaxed in a rhythmic manner at least for 10 times. You squeeze and hold for 10 to 12 seconds and then do the step 2 and 3 to complete one cycle. You can repeat the cycle at least 3 times a day. So as you strengthen, you can increase gradually to 6 to 10 cycles per day with shorter rests depending on your, if you're getting comfortable with the procedure. So what you can't control as regard to pelvic floor dysfunction is the natural aging, which we cannot stop, and childbirth, which is again a normal, which is a normal thing for any woman. So in which case, so these two are said to actually worsen or weaken the pelvic floor muscles, but it doesn't stop there. So please take up the responsibility, prioritize your health. These things you can do to improve your pelvic floor health. One, the lifestyle modifications like reducing caffeine, alcohol, and carbonated drinks, proper exercises, both core and Kegel's pelvic floor exercises, good diet, and all the seeking of medical help at an appropriate time will help benefit for a long-term benefit. So at the outset, when more women are economically empowered, economies grow. So when more women prioritize their overall health, families thrive and flourish. So start today, start now, seek help and prioritize your health. Thank you, everyone. So this is in short about pelvic floor dysfunction.
Thank you so much, doctor. Actually, it was a very great presentation about the very important group of muscle. And as you mentioned,
Thank you.
like embarrassing condition, people still feel shy. They have to break the stigma and should come out because all these problems can be treated and they can lead a very healthy life actually. Very well explained. Any questions from the participant side? So we have a question, doctor.
Yeah.
One participant has said, like, I'm experiencing this after my radical hysterectomy done recently.
Incontinence. I suppose she must be experiencing stress incontinence likely. Urinary leak, is it? I
Uh,
think it's in the chat box.
yes, it's in the chat box.
Yeah.
The participant, can you be please clear, still more clear about the thing?
I
You
just
can
wanted
write
to
in the
know
chat.
what kind of, I think she must be experiencing urinary incontinence, stress incontinence, because after hysterectomy, what happens is the support of the uterus are lost. So the same ligaments also to some extent support the bladder as well. Since the main supports of the uterus are cut during the procedure, during the surgery, uh, this particular patient will have problem with stress incontinence. So for her, may I know the age of the person as well?
Ma'am, can you mention 49?
Yeah, 49. Okay. So this 49 perimenopausal age group, or probably now she's undergone hysterectomy. So in which case, loss of the pelvic floor support will cause her this trouble. So the ideal treatment for her would be to start doing Kegel's exercise, pelvic floor exercises regularly, and that will actually bring about a lot of symptom improvement in her. Frequency of Botox usually depends. The frequency of Botox injection that's Botox injection, we usually give it for overactive bladder, not for stress incontinence usually. I think one person has asked about Botox injection. Botox injections, we give it for overactive bladder, otherwise called as urge incontinence, wherein you will have the urge to pass urine, but before you could reach the restroom, you start leaking. So, to reduce the tone of the bladder muscle, we give this injection into the bladder. This usually requires multiple sittings. Usually, this Botox injection can be repeated once in 6 months. Based on the symptom improvement, it can be done in 3 to 4 sessions at a gap of at least 4 to 5 months to see for the response. And this Botox injection is again temporary. It's not lifelong. So even if you've taken the Botox injection 3 to 4 sessions, it's important that you continue doing your Kegel's pelvic floor exercises. If you're a little on the overweight side or obese, weight loss, at least 5% reduction in weight loss said to bring about symptom improvement to around 50% improvement in your incontinence symptoms. So address the risk factors, start your Kegels. You can definitely go for Botox, but only for overactive bladder and not for stress incontinence. Yeah, thanks.
Yeah, I think she's very clear. Thank you so much. So it is very clear now that when we have to approach a gynecologist, please break the stigma. Don't keep it with yourself. You can share with your doctor. So every problem of women's health can be treated now. So let's move on to any more questions? Thank you so much, doctor.
Thank you so much. Thanks for the opportunity.
So can we move on to the next speaker? I take the pleasure in inviting Dr. Mariam Farzana, physiotherapist. She's an assistant professor in obstetrics and gynecology at SRM College of Physiotherapy, pursuing her PhD in OBG. Totally, she has 10 years of experience and has got a Guinness record as a convener for Physio Run, a gold medal in Research Day, have conducted many workshops and seminars in antenatal physiotherapy care. She's also published many Indian journals, many national and international journals, and she has received an International Inspirational Women Achiever Award for Outstanding Performer in the field of physiotherapy. We are very much happy to have you here, Mariam. You can share your presentation.
Thank you so much. Thank you for the introduction, Divya. Very good evening to one and all present here. I would like to extend my warm wishes for the Women's Day. And also, I congratulate IAP Women's Cell for organizing such programs in organization with the Innovel, who have taken an interest to organize this on the Women's Day about the pelvic care. Is my screen? I'm not able to share my screen.
Bhargavi,
yeah,
ma'am, can
sorry.
you
I think that's my yeah, done.
Thank you.
Yeah.
Is it visible?
Yes, yes, doctor. Yes, doctor. It's
Yeah.
visible.
Yeah. Today, I'm going to talk about unlashing the impact of coarse floor. So I have heard that today's participants are more from the general population and not from the medical field. So my presentation would be in the mode of making you understand what is pelvic floor muscle and how it works in our body and what all will be the problems which a women can face in a period of life, and the treatments which are available, and when to approach a gynecologist or a physiotherapist or a women's health physiotherapist. So we are going to talk about the impact of core's floor. It means that there is a floor of a core, which is very, very important. Core muscles are very important, and these days it creates a lot of impact that everybody speaks about core strengthening, core muscle improvement. Anywhere you can see that it has become a very fancy word that people talk about core, but there is a floor which we have to more concentrate on. So that is what we are going to talk about today. So one second. Yeah. What is pelvic floor muscle? So I don't want to go in detail about all this because the madam has already described so many things very beautifully. So one thing I want to tell is pelvic floor muscle is a very important muscle, and these are very small, small muscles which supports our visceral organs like bladder, uterus, and also our rectum. The whole pelvic viscera is being supported by the pelvic floor muscle. Now, where is this pelvic floor muscle? How do we understand, like, where is it? How to locate it? So, yeah. So this is the floor, that is the below part of our pelvis, which is been with a lot of muscles, and we have so many muscles there, which connects and hold our organs, which are placed above the muscles. Okay. Now, talking about the biomechanics, I just want you to understand and cooperate with me in understanding. Just imagine this as your cylindrical body, and this outer part is your abdominal muscles, and this behind part is your back muscle, and the upper part is your diaphragm, and the below part is your pelvic floor. So here, the upper part where I'm talking about is your lungs and other stuff like stomach and all is there. That's all in the upper part. And here, the lower part is what is giving the leverage for the whole bottle where I'm holding. That is your torso. So this floor is called as pelvic floor. So how important is this? And how importantly we are taking care about this is what we are going to talk today. Okay, so this floor is very important, and it is going to hold our organs. So biomechanically, this floor is what is giving a leverage to the pelvic organs. So these are the pelvic organs which are placed naturally in anatomically towards the gravity. It is facing towards it. It is not placed upward. It is actually placed like this. So every organ is facing down. It is not facing up. So it is in a towards gravity position. So can you see a picture here where it is showing as a healthy, that is the first picture, the healthy abdomen and the weakening of the pelvic floor muscles. I hope you will understand more. The lower part is what is a pelvic floor muscle, which has been holding by the whole of the torso. And here the weakness, when your stomach gets, after delivery, after multiple pregnancy or obesity, what happens is your stomach changes its position. Automatically, your posture will also change. When your posture is changing, you will get an increased lordosis, that is your increased arch, back arch, and also you will be leaning forward. This not only happens only in the obesity, but it also happens in the pregnancy, right? So when all this happens, the stretching, that is the lower part of your pelvic floor, starts stretching more. When it starts stretching more, the leverage, automatically the leverage will start going. So when you increase your intra-abdominal pressure. When is your intra-abdominal pressure getting increased? To be in a very, very layman's word, when you cough or when you sneeze or when you pick up a heavy object from the floor, for example, a 10 liters of water bottle or 15 liters of water bottle, you try to hold your pressure inside your body, that is inside your stomach, and try to lift the object. So when you do all these things, the intra-abdominal pressure raises, and when it raises, there will be a stretch for all these muscles. So just a simple example I would like to tell you right now is, please all of you sit straight and try to contract your abdomen. That is, try to contract your tummy. Just drag your tummy in, just like how you do take in a photograph. Just try to contract it. When you contract your belly, what happens is automatically you can feel a pressure in your pelvic floor muscle. I hope you will all will be feeling if you are following me. And this is what is, there is a co-contraction between your core and your pelvic floor. That is the floor, which madam right now told about the Kegel exercise. Kegel exercise is one of the toughest exercise which anybody can do, because locating the pelvic floor muscle is very, very difficult. We'll talk about Kegels a little later. Here, connecting your biomechanics, that is what I was trying to tell you. When you try to hold your abdomen in, automatically your pelvic floor muscle will start trying to contract. So that's how the core and pelvic floor is connected. So you have to be very careful when you start trying to activate your core muscles. Either there are many hacks now that people follow, YouTube channels, a lot of Instagram reels, and so many things to lose weight after pregnancy. And when they suddenly decide to lose weight, they follow some kind of channels to just focus on that. That is very wrong thing, because nobody knows that what is a person's muscle power and how that person is performing the exercises. There might be already a sports person, they might be already an exercise person, exercise and gym goer, but the person who's following it has to take a lot of concentration about their abdominal muscle as well as their pelvic floor muscle. Yeah, I hope you would have understood this. And coming to this board and dock theory, I told you where is the pelvic floor muscle and how the pelvic floor muscle is connected, and how your viscera, that is your organs, that is your bladder, uterus, and also the rectum, anal opening, all is connected towards the gravity. All this I told you. Now, can you see this picture on the slide? It says that it is a boat in a dark dock. Yeah. So the water which is down is your pelvic floor muscle. Those muscles, when they are down, when they are low, that is when they have no power, losing their power, automatically that the board is your organ. Automatically the organ will fall down. Yes. So when the pelvic floor muscle is having a good strength, it has a proper muscle strength, it means that it will hold your visceral organs at the exact point. If it is not there, if it starts losing its strength, slowly the organ will try to fall down. It means that it will start to try coming out through the opening, that is the orifice which is there in the body towards the gravity. That's a simple logic which you have to understand. When you keep your pelvic floor muscles properly toned, strengthened, then the organs are safe. That is your visceral organs. If you don't keep your pelvic floor muscles in a proper good health, then automatically the organs which are above it are going to come down. So that's a very simple picture which shows about a deeper knowledge. So I hope you will understand the importance of pelvic floor muscles now. Yes. Now, what does this functions of pelvic floor muscle do? What does it actually do is, this pelvic floor muscles supports the pelvic organ, as I told you right now. So it supports all the organs which are above it. That is your bladder, uterus, and the rectum. That is called as pelvic viscera. And the next one, which is the pelvic floor supports during pregnancy. That is very, very important. Generally, it supports the muscle. When the person is pregnant, it is automatically going to hold a lot of weight. And also those weight has to be taken up by your pelvic floor muscle. The pelvic floor muscle not only supports your visceral organ and supports your pregnancy, but it also supports the breathing. That's why I told you when you do a tummy tuck in, so there will be a co-contraction of your pelvic floor muscle. Yes, the pelvic floor muscle, the abdominal muscle, and also your diaphragm. Diaphragm is the upper part, which I told you when I was explaining through a bottle. The upper part is the diaphragm, that is below your lungs. So all this together are interconnected, and all this muscle together are going to give you a lot of leverage without making your pelvic organ to go down. If your abdomen is going to get weak, if your abdomen is going to get weak, if your back is going to get weak, and you have a different kind of breathing system inside you, you have adapted a different breathing due to a different posture, prolonged sitting, and all those things is going to directly give an impact on your pelvic floor muscles. So it is very important that we have to correlate all these things and make a healthy lifestyle. Now, not only about that, the pelvic floor supports the bladder control. Bladder is very, very important. And the bladder control, when there is no bladder control, there might be a leakage in the urine, which has been already explained. And the pelvic floor supports the bowel control as well. The important function of a body is the bladder and bowel control. And the bladder and bowel is being supported by the pelvic muscles. The pelvic floor muscles not only support this, but it also supports the sexual intercourse, that's the sexual function as well. So now coming to the pelvic floor dysfunction. So we have seen what is pelvic floor, where it is located, how it is located, and what is the action of pelvic floor and the functions. Now, how does it go for dysfunction? We are going to see how it goes for dysfunction. When there is going to be a dysfunction, what all are the chances that you might be receiving as a complication, and how you will identify that, yes, I have this symptom and I have not gone to the doctor yet. So all those things are going to be explained one by one. So making it very simple with a lot of representation with a diagram I have made. If at all there is any query at the end of the session, you might ask me. So here the pelvic floor dysfunction, I told you there are going to be three things about the pelvic floor: the bladder, rectum, and the uterus. So the first picture says about the normal anatomy, where all three of them at its piece with the pelvic floor muscles just shown in the hammock. So all three are placed above it, and there is nothing which is getting weak or which is getting strong, and it is normal. So before going to this, pelvic floor dysfunction can be in two ways. One is because of the tight muscle. Another one is because of the weakened muscle. Tight muscle is going to give you a different type of symptoms, and a weaker muscle is also going to give you a different type of symptoms. You might not ask me like whenever it is weak, it is going to be a dysfunction. Even if it is tight, it is also dysfunction. There can be dysfunction in the viscera, in the muscle, and also in the skeletal system. Skeletal is your bone. So all these things are interconnected. Whenever the pelvic floor muscle is not working properly, it might get or it might show as consequences in three different ways. One is through skeletal system, that is pain. So it might show as sacroiliac joint dysfunction or pubic dysfunction. Sacroiliac joint dysfunction is nothing but a person can complain that I have pain when I am walking. Okay, when I'm walking, I have a severe pain in one side of my hip. Not on the back, it's on the hip. And the person can also complain that when I am trying to get out of the car or placing one leg out, I'm having pain. So this is called as sacroiliac joint dysfunction. And this is also because the person might have pelvic floor dysfunction in these cases. Not only this, and the person can always say, when I am trying to wear my pajamas, or when I'm trying to trying to wear my clothes only on one leg if I'm standing and I'm getting this pain. That is a classic symptom of sacroiliac joint dysfunction. The person can also complain skeletal system pain, and also the person can complain pubic pain. That is exactly on the above aspect of your vaginal area, exactly opposite to your hip, that is on the front side of your hip. You might say that the person can have pain. That is called as pubic dysfunction. That is also possible because of pelvic floor dysfunction. When the muscle doesn't work properly or is not in a proper leverage, it can also lead to skeletal problem as well. This is skeletal problem because of pelvic floor dysfunction. There can be muscular problem. That is what we are talking. When the muscle is not working properly or not in the proper leverage, it can lead to visceral problems like this. The first one which we are going to talk about is the prolapse. Here in prolapse, I told you about the normal anatomy. When the muscle is proper, when there is no weakness, this can happen. There is no problem at all. Normal anatomy will be maintained. When the muscle is slightly weak or the front side of the muscles are weak, then there might be a cystocele, that is bladder. Only the bladder part might slowly come down, and that is called as cystocele. Bladder can come slowly outside, and that is because of cystocele. The next one is rectocele. Rectocele is nothing but your intestine, the anal area, through that the intestine can come out. That is called as the rectum prolapse. That is also because of your pelvic floor muscle weakness. The next one is uterine prolapse. The uterus itself can come out through the vaginal opening. That is called as uterine prolapse. So this is a normal presentation about all this uterus, bladder, and rectum to make you understand. So this is an anatomical representation. Can you see the first picture where the rectum is slowly trying to come out through the anal opening? The rectum will bulge and slowly that bulge can come out through the anal opening. That's the first picture. And the cystocele, your bladder can come out in cystocele. In the second picture, the highlighted part is the cystocele. I'll show you the uterine prolapse. Can you see the uterus slowly trying to come out through the vaginal opening? Yes. So this is uterine prolapse. So all this is because when the pelvic floor muscles does not have proper muscle texture, proper muscle quality, it slowly comes down. That is weakness of pelvic floor muscle. It comes out through the vaginal canal. Okay. And next, talking about the vaginal vault. So the descent of the vaginal cuff, that is a passage, vaginal passage can come out slowly. So that is called as vaginal vault. This is also happens because of the pelvic floor muscle weakness. So that's about prolapse. And the next one, the next condition is paradoxial puborectalis contraction. Puborectalis is a muscle. And this muscle contraction, here what happens is the person, even after voiding, even after defecating, that is even after passing motion, still feels that there is incomplete evacuatory sensation. The person still feels that I'm still not empty, it's still full, and or I'm not complete. No, I have not completely voided. So that can be because of puborectalis contraction. That is a muscle contraction that might also create a problem like this. This is also one of the cause for pelvic floor dysfunction. The next one is Levator-Ani syndrome. Levator-Ani syndrome is nothing but the person will have spasm of the pelvic floor muscle. Spasm is nothing but stiffness or tightness of pelvic floor muscle, and there may not be any proper reason for this, but it can be because of some postural changes and the support system, which or the leverage changes due to the pressure throughout sitting, or might be altering it to get a improper position in a workspace or something like that, can create this Levator-Ani syndrome. The person can tell us that the person feels a lot of pain and spasm in that area, near the buttock area. Yes, the next one is coccydynia. Coccydynia is nothing but a person says that I have pain while sitting, the tailbone pain. This can be because of the reasons of delivery, or might be because of person has fall, or sometimes due to increase in weight can also cause this coccyx pain. And that is because this is the smallest bone. And how it got this coccyx name is coccy means it is cuckoo. So that's how it's just exactly like the cuckoo beak. So it is named behind that. So this is, it might take alteration in the position. So we need to alter it. This alteration might be because of the improper pelvic floor muscle texture, or the pelvic floor muscle might be very tight, or because of the leverage, it might be pulled towards another side. So might be because of that, the coccyx pain can be there, and it can also be corrected. The next one is uh, Proctalia frogis, and this is again because of the spasm of the or hypertrophy. Hypertrophy is nothing but tight pelvic floor muscle. Tight pelvic floor muscle can also cause this problem. That's what I told you in the beginning. Either the weak muscle or the tight muscle can also create problems. So here the patient can complain that they have a rectal pain, intermediate rectal pain. They might tell, I feel a very tight symptom in the even after voiding or even after doing nothing, also they can complain that I have pain in the anal area and I have a severe pain in the anal area. They can say that it is a pulling pain. It's a pulling pain, and after a few episodes, it relaxes by itself. So that is because of this hypertrophy, that is increased tone of pelvic floor muscles. And the next one is pudendal neuralgia. This is the most neglected one. This is a nerve. It is an important nerve which supplies the reproductive organ of both male and female. And this might be, this is neglected because people don't know to differentiate between what is a back pain and what is a groin pain, or what is a pelvic organ pain. They just say it is a back pain. That's it. Even when they're describing the history, they say it is a back pain. So making this as a point, I want to tell that pudendal nerve pain is there can be a compression of the nerve, and this is due to a prolonged sitting positions, due to horse riding, or due to compression, or due to adapting an improper position and feeling that it is an improper position and putting a lot of pressure on the sitting area, or even a bicycle riders can get this pain because the seat of the bicycle is not apt with the person's pelvic area. So nowadays the seats are designed in a very fancy way, in a very fancy method. The people try to adapt only according to the company brand and the style of the seats and the cycles, neglecting the ergonomical uh, uh, the ergonomical seating positions and the person's pelvic area. So all this has to be considered. Because of all this, there is a lot of symptoms like pudendal neuralgia, that is compression of the pudendal nerve, and this leads to a lot of pelvic floor dysfunction, as because that's a nerve which supplies the pelvic floor. And also because of this, there is too many sexual dysfunction as well because of the pudendal nerve. So that can also be one of the reason. The next one is urinary incontinence, which has been already told in detail because of pelvic floor weakness. This is caused because of the pelvic floor weakness. When there is weakness of pelvic floor muscle, when you cough or sneeze, the intra-abdominal pressure, which I told you, the pressure inside your stomach, you try to hold and cough or sneeze. When you do that, automatically there will be a dripping. This picture, the first picture, shows you a very clear animation of when your bladder is full. When a person coughs or sneeze, automatically some drops of urine will come out. Here, the person might have stress incontinence, urge, overflow, neurogenic, giggle incontinence. So many incontinence are there. The person can have a stress incontinence when there is a lot of pressure in the increase in urine, and a person coughs or sneezes, there might be a leak. Urges a person whenever the person tries to go out of the house or something like that, they have an urge to use the washroom repeatedly. They try to go and empty their bladder repeatedly. And overflow incontinence is even when there is a slight or increase in urine, they try to void again. Giggle incontinence, when they cough or when they try to laugh a lot, they try to laugh or cry, there will be increased intra-abdominal pressure and slow leakage will be there. And this is because of, there can be a neurogenic bladder. This might be because of many other reasons, but one important reason is pelvic floor muscle weakness. The next one is sexual dysfunction. This is also related with your pelvic floor. You have to take a proper care of pelvic floor. There can be a lack of sexual desire, that is desire disorder. And then the arousal disorder, inability to become physically aroused or excited during the sexual activity. This can also, in pudendal neuralgia, which we spoke just now, because of the cycles, bicycle riding or horse riding, all these things, there is a compression of nerve, I told you. And because of that, the person might feel they have an arousal sensation throughout, and it does not subside it within a day or two. This is a specific condition called pudendal neuralgia, and here persistent genital arousal disorder. This is called as persistent genital arousal disorder. The person get arousal feeling, but it does not come to an end. It goes for years and months. It might subside for just in 1 hour or 2 hours. Again, the elicitation will start. The person will have an arousal disorder, and the arousal might keep going. So until or unless the compression is released of the pudendal nerve, it does not subside. So that is also a sexual dysfunction. Then orgasm disorder, delay or absence of orgasm can also happen because of pelvic floor, weakened pelvic floor muscle. And pain disorder, pain during intercourse, that is vaginismus, when there is increased pelvic floor muscle tone. Okay, when there is increased tone, the person does not allow or have a phobia for sexual intercourse, can also cause this pelvic floor dysfunction. So moving to the next one, the symptoms: painful urination. The person might have a lower back pain, pelvic organ pain, constipation, discomfort during sexual intercourse for women. So all these are symptoms. They might just tell us the symptoms, but we have to go through a lot of history. Whenever you open up, only then the medical person who is trying to help you out can come out with a proper diagnosis. There have to be done a proper medical assessment, proper, you have to meet a gynecologist, a proper assessment has to be done. And then it has to be given with the proper Kegel exercises. Biofeedback can be done for few of the exercises, like when there is a weak pelvic floor muscle, you have to go for strengthening exercises. When there is tight pelvic floor muscle, you have to go for a relaxation techniques of pelvic floor muscle. And when there is a skeletal system problem like SI joint dysfunction, I told you sacroiliac joint dysfunction, other thing, then orthopedic physiotherapy, then the OBG physiotherapy, also obstetrics and gynecological physiotherapist also should correlate and then treat you. So these are the major things which I wanted to tell from my presentation. And also, one important point which I want to tell in this presentation is, in community, women play a very imperative role together in taking care of our family and professional workers. Pelvic floor disorders are prevalent among women, but still the symptoms of pelvic floor dysfunctions are being predominantly treated, but still there is, on contrary, the influence of associated factors which directly and indirectly cause the symptom goes untreated. The consequence of the pelvic floor dysfunction reduces the women's quality of life, limits their productivity, input in the society. To some extent, women go unnoticed. And hence, we look forward in treating the root factor, which will significantly create a eco-physical sexual lifestyle among women, so that women can play an exceptional role in taking care of the family and creating the harmonious society. That's what I want to tell throughout this presentation. Please come out with your problems. Just break the taboo. You don't have to feel about a shy, or you don't have to feel shy or feel uncomfortable talking about the problems. Whenever you come out, there is a solution. Thank you so much. If you have any questions, please ask me.
Oh, thanks a lot, Dr. Mariam. It was actually a very wonderful performance. Any doubts from the participants? I think it was very clear, right? Yeah, very clear and informative. Thank you, Mrs. Gayatri. Any, you can put it in the chat box. Any specific questions to Dr. Mariam? Thank you so much, Mariam. Thanks for joining this evening.
Thank you, Divya. Thank you so much.
Okay, I think we have come to the end of the session. I request Dr. Parvati ma'am to give a vote of thanks.
Thank you for the opportunity, Dr. Divya. On behalf of the Indian Association of Physiotherapists and Indian Association of Physiotherapists Women's Wing, Tamil Nadu, Chennai district, I would like to thank our mentors, our IAP president, Dr. Sanjeev Jha sir, IAP treasurer and All India head IAP Women's Cell, Dr. Ruchi Vashni ma'am, our zonal head, Dr. Mercy Jayapal ma'am, and our state head, Dr. Janani, for the wonderful opportunity to conduct a webinar on such a useful topic. I thank the Inner Wheel Club Chennai Unit President, Mrs. Meena Satish, for collaborating with us in presenting this unique topic to the members. I also thank the Inner Wheel Club members for their patience throughout the session and being interactive through their questions. I also thank the other participants for their the time and patience to listen to the speakers. It will be unfair if I don't mention about our speakers today. Both young dynamic speakers, Dr. Bagar ma'am and Dr. Mariam Farzana ma'am, for your informative presentation. You both made it very crystal clear. And I think that's the reason many of them didn't have much doubts. And, you've opened their brains to think about their symptoms, if at all they have any, so that they can discuss it with their friends, relatives, and women counterparts in their life. I thank our team members of Chennai District IAPWC, Dr. Divya Karthik and Dr. Priya Harikrishnan for helping in planning and executing and conducting this webinar, identifying the topic, identifying the speakers and all that. Thank you, Divya, and thank you, Priya. Without the cooperation, this session may not be successful like this. I hope and wish that the knowledge shared today is absorbed to a maximum level by our participants, which they can use for themselves and share with their friends and relatives in case of necessity. Today's webinar definitely improved our understanding and cleared some common doubts regarding pelvic floor health. Through this webinar, we urge our participants to identify the symptoms if they have any and reach for the proper professionals like your gynecologist or your obstetrics and gynecology, women's health physiotherapists. Let's improve and maintain good pelvic floor health so that nothing stands in the way of empowering ourselves and empowering other women in our lives. Thank you, everyone. Once again, I wish you all a happy Women's Day. Let's take care of ourselves and empower ourselves. Thank you.
Thank you so much, ma'am. I extend my gratitude to Dr. Srinivas for hosting this webinar from IAP Digital team. Thank you so much, sir. And thanks to all the speakers. As Parvati ma'am said, it was really a very informative session. Hope everyone were clear about their health issues, like if any. And kindly, again, I wish to say the same thing. Break the stigma, come out, talk to a doctor, a gynecologist, consult a gynecologist. And we physiotherapists also here to strengthen your muscles to make you lead your life back to normal. So this is all a very common problems we have. Every woman can face this incontinence problem. So there is a solution for all these problems. And thanks for the participants and the Inner Wheel Club president for helping us, for cooperating us for this webinar.